Hello, everybody. Welcome to our second series of the APASL webinar. We finished our first series about 2 weeks ago, and that series was concentrated on COVID-19 and different aspects of COVID-19. It has since finished, and we are starting our second session. Those of you who have missed the first session, you can actually catch it up on YouTube. For this second session, we wouldn't call it the COVID seminar anymore. It'll be called the Hepatology seminar because we have run dry on topics on COVID-19 already. So we are spreading our wings to talk about other hepatology topics. But first, we'll have to finish with COVID in Shanghai. My name is Richard Guan. I'm from Singapore. My co-chair is Professor Thomas Berg. He's head of the section of hepatology at the University Hospital in Leipzig in Germany. His research interest is in liver transplantation, hepatocellular carcinoma, chronic viral hepatitis, and liver failure. He co-edits the Journal of Hepatology. So if you want your manuscripts to be published there, be nice to him. Okay, our speaker today is Professor Zhang. Professor Zhang Wenhong heads the Clinical Center for Infectious Diseases and Liver Diseases in the Huashan Hospital, Fudan University, Shanghai. He also chairs the Society of Shanghai Infectious Disease Physicians and is the General Secretary of Chinese Association for Infectious Disease. He graduated from the Shanghai Medical University and spent some time in the United States as a research fellow at Beth Israel Deaconess Medical Center, which is affiliated to the Harvard Medical School. He also spent some time as a senior visiting scholar in the Department of Microbiology and Immunology at the University of Illinois in Chicago. His research work focuses on pathogenesis, diagnosis, and treatment of viral hepatitis, bacterial infections, and other infectious diseases. He has been involved in studies related to TB treatment, chronic viral hepatitis. He has published about 125 papers in international peer-reviewed journals. Now, can I invite Professor Zhang to tell us about his Shanghai experience with the COVID-19?
Yes, Professor Guang, I'm very glad to be invited to give an introduction about the Shanghai experience for fighting the COVID. So actually, I worked in hepatology for many years with all of you here, and I visited the Asian other countries for some times, and also attended the APASL meeting for several times. However, this time I'm just the group leader of the. I worked as the chairman of the expert committee in Shanghai. You know, in China, infectious disease included a broad coverage, very broad, and including the infectious disease and liver disease all together in the Department of Infectious Disease. So this time, actually, I in charge of the treatment and also preventing of the COVID in Shanghai. So here I'm just want to share some experience in my own opinion about how to control the disease in a big city like Shanghai with 30 million people. So today I think we just have no local cases already for many months. And of course, we just have several asymptomatic cases in Wuhan. However, today in China, we just want to discuss about how to get back to normal. But of course, I just wanted to share the experience about our choices at different crossroads. So first of all, I just want to see what happened in the Asian countries today, especially in the Eastern Asian country, which we can see here. So Singapore, Indonesia, and the Philippines still have several hundred cases every day, and Malaysia and several hundred cases every day. However, in some other countries in Eastern Asia, Thailand, Myanmar, Vietnam, Brunei, and Cambodia, and Laos, and they're very good. Only under the 10 cases. So China, I think in the Asia, among the different countries, still we stay at a very low level of the disease control. So today we just want to talk about how to get back to normal and how to eradicate the disease in our countries and also in some Eastern Asian countries, and how to control the disease around the world. So first of all, I just want to share the experience at the first stage in China. We know that in China, at the first stage, we just separate the whole country with epidemics with different levels. So some city, just like Shanghai, we just stay at a very early stage. So during very early stage, we just do maximum tracing and detection, and we just give the measures for social distancing and give the hospitalizations for every patient were found. So this is just what we have done in very early stage. And the city, just like Shanghai, actually, we did not shut down totally. So in some other cities, just like province Henan and some province around Hubei and Wuhan, they just in the progressive stage. So we do a more aggressive strategy for those provinces. However, for the epicenter of the disease, it just we know that it was Wuhan. We just locked down the city and break the transmission chain within the whole cities. So so we can first of all we just see what happened in Shanghai. Once we stop the once we lock down the Wuhan, we know that actually there were some several hundred cases already transmitted to Shanghai. And according to the mathematical model, we know that if we did not lock down Wuhan, maybe nearly 800,000 patients will be in the end in our city. But if we only ban the Wuhan travel and lock down Wuhan, still there would be 200,000 cases. If we not lock down Wuhan, we just took the national emergency response, still 200,000 cases. But if we lock down Wuhan, meanwhile, we just took the national emergency response. What we took the strategy right now, we know that according to the mathematical model, it would be 30,000 cases in the end. However, today we know that we only lastly in the first wave of the epidemics, we just have 350 cases together in our city. So I'm here just want to share what we have done in our city. So this is a map what we have done in our city, the epidemic trend in Shanghai. So we have two waves. First wave, we know that we took the response, the top level response to the major public health emergency, lockdown Wuhan here, and we did the tracing maximally. We did the detection maximally at the end of the January. So only after several weeks we control the disease. So after that, almost no new local cases in our city. And after that, but today we still here we can see that there's another wave. This wave is just imported cases. So today we just stay at the stage to control the imported cases in our city. And the whole city in Shanghai, actually we just almost they open more than 90%. So our economics and our schools and everything now they open. Only the cinema and the theater maybe they open soon in our city. So this is what we have done in Shanghai. So if we see more detailed in the Shanghai, we can see here the color of the bars. The red bar stand for the imported cases from Wuhan. The green bar is just the cases from the transmission. I just mean the cases from the second generation of the disease or third generation of the disease. We can see here if we just took the very effective control of the local cases, and the green bar, which means the local transmission is very low. So this is, I think, is the major experience we took our city at the very early stage. I mean, the control the disease, control the transmission in the community, do tracing, good detection is very important in our city. So we can see the total reported cases among different countries and the different regions we can find it here. So Shanghai state here several hundred cases. The United States today, we know that there's almost 2 million cases. So we just want to, and also other Wuhan, we can see here almost 100, almost near the 100,000 cases. So I just want to compare the Wuhan and the Shanghai, and we can compare the strategy we took in these two kinds of the city, and we can know what kind of strategy we can take if we stay at the crossroad of the epidemics. So if we compare the transmission of the local transmission in the community, we can see here, this is data from it. So from Europe, in some, just here, we can see that Italy. Italy mainly, these cases are not the imported case. So mainly they are the local cases. So the measures took in Italy, actually, they also took very strict measures. However, there's lots of the next generation patients after the local transmission. So if we can control the local transmission after the important cases at a very early stage, I think we can control the disease at a very early. However, if we have lots of patients in our city, I think maybe there will be overwhelming of healthcare capacity. So if the early control, I think, of course, we can control the healthcare capacity overwhelming. So I compared the mortality in Wuhan, and I also compared the mortality in Shanghai. I know that the mortality in Wuhan is much higher than that in Shanghai. So therefore, our experience is, I think, according to my experience, I think in Shanghai, if we have a lot of patients, just like in Hong actually, I think our mortality in our city will be also increased very fast. So our strategy in Shanghai, we just take the early prevention. So only almost 370 local cases. The healthcare resources not overwhelmed. However, in Wuhan epidemic center of the outbreak in China, more than 50,000 local cases, and the healthcare resources overwhelmed. The mortality skyrockets in the early epidemics. So our strategy, we can compare the beds in Wuhan. At the mid-January, in Wuhan, only 2,000 beds, it can be accommodate the COVID patients. I mean, the ID department, the beds only 2,000. But if we take the help from other provinces in China, lastly we extended the capacity of the beds for the COVID. We mean that in the mid-March we have almost 35,000 beds in the city. So if we compare the initial hospital beds and the critical beds, we can find here. Lastly, we actually, the capacity of the beds is very important to decrease the mortality in our city. So in Wuhan, we mean if we just stay at the epicenter of the outbreaks, it's very important for us to do the tracing more and find the ICU beds, find the capacity of the medical resources extended is very important. So therefore, in order to break the transmission chain, we took every patient we found and give the function short hospitals here. We can have the hospitalizations for every patient and stop the local chains. So because firstly, we found that family transmission is very important in our city. So it's very important to find every patient as possible as we can and give the hospitalizations. So what's the Shanghai strategy during that stage? I mean, at the end of the January and after that 1 month, we control the disease at a very early stage. So at January 23, 2020 in Shanghai, we launched the level 1 public health incident alert. So the government, medical facility, and the community, we worked together for that. What we have done is just to do the strict management of access to Shanghai. You can see here. And meanwhile, we give the color. We have a color-coded electronic data for everybody who went to Shanghai. So if the red card, it's a red code, actually, we will do the quarantine. And also we have some other code. For the yellow, we will do the detection and also quarantine observation for several weeks. So green code, red code, and the yellow code is so in the very early stage we took in Shanghai. This is together with the mobile phone. So it's very important for us to control the access of the people who went to Shanghai. So we give the conclusion of the Shanghai's experience to control the disease at a very early stage is just we maximizing the testing, we maximizing the tracing, also we do maximizing hospitalizations. So I think this is a very important experience to control the disease at a very early stage, and not so many second generation patients after the local transmission. So if we have lots of patients, if we have almost have just like that in Wuhan, I think Shanghai we cannot do better because the medical resources is very limited if we have so many patients. So in the future, I think such experience also is very important for us. So today, actually, we studied the experience just like Singapore. Professor Guang, you know Singapore very well. There's a network for the fever clinic. So in Shanghai, we also have almost 400 fever sentinel hospital and a designated hospital for COVID. So if the patient is suspected of the disease, we will give the detection immediately. So it's very important for us. Today, we just test all, trace all, and admit all for every suspected patients we can find. But very lucky that today we do not have any local cases in our city today. So we just have some imported cases because every country will reopen in the forthcoming several months. I think today our challenge is that we should have the network of our public health system to control the imported cases. Our strategy today is that we just want to keep our almost near zero cases and to keep our economics, to keep our society normal. So what's our option as a new normal state today? So I will give the data here. We can see. So today we can separate the world for 4 kinds of the situation of the epidemics. Firstly, we can see here, left side, the upper left, is increasing trend. Russia, Brazil, and India still stay in the increasing trend. And some in the plateau, we can see here, this is United States. And of course, in the Eastern Asia and Europe, I think it's very good today. This still in the reducing trend. However, in some other Eastern countries, just like in Asia, just like the Vietnam and Laos and they're very good. And of course, China also stay here. So the cases almost under the 10 cases a day. So this is a different situation in the world. If we want to go back to normal, I think the situation is different. The strategy should be a little different. So if we compare the more data within the world today, we can see this is China, almost no local cases, and there's Asia still very slowly increasing, but the US, United States, and Europe at a very high, high numbers of the disease. Also, if today all the world reopen together, I think still there will be a problem, because today we have noticed that there was some rebound in some countries. So this is data from Iran. We can see Iran that today we can find that rebound it is still there. So if we get back to normal, I think the rebound would be there. So I think it will be a great challenge for the world. So today we will discuss about how about if we have lots of patients, how about we take the strategy of herd immunity. So this is data. One of our colleagues, everyone here know him very well, Jinling Ho. His team did the serological data, the survey in Wuhan in Hubei province. We can see here the IgG prevalence among the different kinds of the population. We can find the healthcare workers and the community residents. So you can see here the serological data. We can find the antibody, the prevalence is not so high. So my question about the herd immunity. If we want to let the Wuhan take the herd immunity, I think we should increase the IgG prevalence to higher than 50%. So that means we should have 10 times of the Wuhan outbreak. So can we take that? Of course, we cannot do that because even Wuhan there's outbreak, the serological data do not see that we have the possibility to take the herd immunity strategy. So today, I think eradicate the virus in the world, of course, today, I think it's not so easy. So most of the time we have to live with the virus. But today in our country, in China, actually the government want to take the near zero cases strategy. So even we cannot eradicate the virus, we want to control the disease near the zero cases. So I want we can keep our economics normal, keep the economic normal in the Eastern Asian countries. We have some communication with different countries to increase the economics. So today in the world, we know that the epidemics among different countries is different. So the strategy may be also different. Some countries, we just want to control the epidemics, and we want to know that we just suppress the epidemics. We take strong measures. We do not want the medical resources to be overwhelmed. But in some other countries like Europe and the Eastern Asian countries, we still now very low level of the disease. We can some way we can go back to the new normal. However, we have to take the strict measures to control the rebound of the disease. So today in the world, I think the COVID is really very complicated disease. We have to live with COVID, but we should not give up. We should keep the disease under control with a minimum impact on the society. So today, I think our experience is just to detecting and tracing network, improve the clinical treatment strategy. We should take the scientific local prevention system accompanied with metadata and a massive scientific research to give the better strategy to control the disease. We have to fight wisely, toughly, and with solidarity. So I think this is our experience. I want to have some experience from you, from other countries. So thank you very much, Professor Guang.
Okay. Well, Professor Zhang, thank you very much. Here is Thomas Berg from Germany. I think this was a very excellent overview of the current epidemics and pandemics in your country and comparing Wuhan and Shanghai. First of all, I think we would like to start the discussion now, and you all listeners are really welcome to send your questions via the chat function or the Q&A function you will find on the Zoom. We already have just one question, but please enter your question. What are you interested in? Professor Guan, you're on mute. Probably you can unmute that we can do the discussion together. Can you hear me? You're mute.
Yeah. Professor Guan is mute.
Professor Guan, you're mute.
Guan is mute, yeah, right now.
Okay.
Okay, now we can hear you. So probably first a question also coming from Germany. You know, we have all these quite similar rules of social distancing, but now there are less restrictions. So with respect to social distancing, what are now the current situation in China, especially in Shanghai? Is it allowed for family to meet or to have, let's say, little parties? How many people can join together? And what about travel restrictions?
Okay, actually today in Shanghai, I think we almost go back to a normal more than 90%. we actually reopen everything. If today we go to the restaurant, we have no restriction for that. But however, we just encourage that we can take some measures for social distancing. Just like if we stay together, lots of people together, we just encourage you to take the mask cover. But however, if we have in the restaurant, actually it's impossible for us to do that. So we can have the conference, but not so many people. Maybe several hundred patients together. It's now today is permitted. But we just encourage you to take the mask cover, but not so you have to do that. So today I think we almost go back to normal, because we have several weeks we do not have any local cases. So in China, you know that we still have some asymptomatic cases in Wuhan, but we did the survey for every people in Wuhan, almost 10 million people. We found almost less than 1,000, just only several hundred asymptomatic people there, and also today quarantine already. So today we take the travel code. So in Shanghai, so in Shanghai, if the code is green, actually we have no strict for anything, just like travel, no strict, and travel is now reopened, and the restaurant reopened. Actually, the school is also reopened. So I think we almost normal today, but we just the scale of the conference, the scale of the theater and the cinema, I think is something controlled, but other than the restaurant and the other, so just like go back to work and the marketing, I think almost normal. Yeah.
Okay, thank you very much. There's one question coming from the chat, and this is, what are the measures for international flights? So I think international flights is still an issue. So what are the measures here?
Okay, international airlines, actually, this is our great concern about that. You know, also recently we know that there's a conflict between the United States and China, because today in China, we almost no local cases, so we still just worry about the imported cases. Actually, I noticed that in Singapore, so the other Asian countries, we just take some similar strategies. We do not want to have lots of imported cases. We do not know our medical capacity is enough or not to control for that. However, every day we still have some international airlines. But today, our strategy for control the imported cases is just we have a closed circle for that. That means everyone landed in Shanghai, we will give the 2 weeks quarantine. And then meanwhile, we will do the PCR for them. So PCR is negative, and after 2 weeks, so quarantine, and it will be okay. So this is a strategy we take recently. So after that, today, no local cases found in our countries, only imported cases. So in Shanghai, we almost have several months no local cases, only imported cases, more than 350 imported cases. So I think actually Singapore, we have more airlines from Singapore and Asian countries. It will be under less risk. But if from the country with a lot of cases, I have a major concern about that. So I think the strategy today, Singapore and the other Asian countries may be very similar. Actually, I also today, every day, I noticed the Singapore open or not. Singapore open, I think it will be very near. We will open together, I think. So because strategy is very similar, because we worry about that, but we still need to reopen. Our strategy is just to control the imported case in the closed circle. This is the strategy we take. Yeah.
Professor Zhang.
Yeah.
Richard Gordon from Singapore. We hear that there is talk between the airlines flying. They're going to fly what we call fast lane to China, to certain places in China, and Shanghai is included. And one of the conditions in Singapore is that they say if anybody comes in, there wouldn't be a 14-day quarantine. In fact, they will have a PCR done. They will have a PCR done at the port of embarkation. That means in Shanghai. And then when they reach here, they will have a PCR done here as well. There's no talk of a quarantine, because quarantine will actually, makes things, business will be impeded because of quarantine. You've got to stay for 14 days before you can conduct business. What do you think of this?
Yes. So recently, actually, I think this is a major problem, the strategy. Just 14 days quarantine, I think it's really is a major problem. I know that in Singapore, previously, and I mean just in the previously, Singapore always takes the stay at home, the home quarantine. But in Shanghai, we just take we have the common site for quarantine. So this is the different strategies. But however, the PCR, I mean just you two time PCR before the boarding and after landing, we do PCR again. I think it's a good strategy. But today I cannot make a decision about how about the quarantine. Quarantine stay at home or no quarantine, or just quarantine at the common site. I think Shanghai still, today I have no change.
Actually,
today, pardon? Go on,
sorry.
Professor Wan.
Actually, in Singapore, at the present point in time, quarantine will be in hotels, not at home.
Yeah. Oh, so if you stay at a hotel, I think we are the same. So we are the same. We still at the hotel. We are same. So no problem. We still today in Shanghai. So we almost the same. We today in Shanghai, we just do the PCR after landing and stay at the quarantine at the hotels. But if the PCR, if the negative, actually, so after 2 weeks, go back. But I don't know if the Singapore, what kind of strategy you take. If the both of times the PCR is negative, still need to stay at the hotel for 2 weeks or not?
Well, at the present moment for international flights, yes. But international flights are at the moment banned in Singapore. They are thinking about flying to certain places like China, Australia, New Zealand, where cases are controlled, and they're thinking of this fast lane thing where you do PCRs, you don't need to quarantine when you reach that place. So, because as I said, quarantine is actually will delay your business.
Yes.
I think that's a bit.
Yes, I totally agree with you. But however, today the international airlines not so many. But if we have many international airlines, I think we have to take some similar strategy. If with low epidemics countries, I think no quarantine is needed. But if the high epidemics countries, I think 2 weeks quarantine is still needed. So we have the consensus, I think.
Yeah, Professor Zhang, there's again a question coming from Pakistan. So with respect to the strategies the airline should adopt to enforce social distancing, to keep the passengers safe and safe traveling by plane. At least in Germany, we do not have really, let's say, social distancing in the airplanes with spaces being left. So what is the strategy here, and what we can advise for the people in Pakistan?
So actually in China today, I think, so every passenger, Chinese, they are very worrying about the disease. So most of the time they will take the PPE them very well. Sometimes very strict, just like the doctor in the hospitals. So it's very ridiculous. However, my recommendation for that is just
Tom
We
mentioned.
lost Zhang for a minute.
Yeah, he lost a connection, so maybe you can take over.
Yeah. So probably Professor Gunn, I think there are some more questions coming from the chat, and the one is, and I think you can also answer this, the indication for hospitalization of COVID patients. So Professor Zhang mentioned that they have now, and the same situation in Singapore, that you have these fever clinics. So when, if a patient is suspected to be, when do you admit and treat him in the hospital?
Okay. Now, that was earlier on in the pandemic in Singapore, we have fever clinics. Even now, we do still have fever clinics. When people have fever, they go and they get tested. Initially, whenever anybody is positive, whether they've got symptoms or not, they would be admitted to hospital. But lately, not everybody gets admitted. Some of them would not go, well, they would still be admitted, but they wouldn't go to a hospital. They will be going to these isolation areas where management, they don't need hospital sort of management. But if they are seriously ill, then they will be hospitalized in a hospital where there is intensive care facilities.
Okay, I think we have Professor Zhang back. You're still mute. Could you please? Yeah, no, that's excellent.
Yeah.
So we couldn't hear the end of the last question, so probably you can.
Okay, I can answer for that. So today today, and you know that the Chinese passengers, so they are very worried about the disease. So most of the time they will take the N95, the mask cover. I think is very, so it of course it's very enough. However, it's not easy for every passenger to take that. So most of the time I think only take the surgical mask. It should mandatory for all the passenger. So it's more better for we just take one seat aside and not so crowded in the airplane. But today you know that the air ticket is not easy to get. So most of the time maybe we do not cannot do that. So actually I think we will encourage the passenger to sleep through the flight and take the surgical mask and do not have the food together without the mouth mask. So and have the handing washing, and the hand washing is also encouraged. If we did so many measures, I think it will be enough for them.
Yeah, and probably not talking, and especially not singing in the airplane.
Just sleeping, not talking. Sleeping, not talking. Yeah.
That's better. And there's again a question I think everyone in the APASL region is also interested. When we come to conferences, well, probably local conferences first, but also international conferences. Is there any advice?
So internationally, so actually in China, with a local conference actually would restart already. So today in Shanghai, sometimes we have the conference with several hundred people together. But for the international conference, I think in the future, if we have to just take the strategy, we have the quarantine. We do the quarantine before the conference. I think of course we can do that. But if we do the quarantine for the speakers or the audience from other countries with high epidemics, so if we have the 2 weeks quarantine, I think it will have a large impact on the business or the conference. We cannot start the international conference. So therefore, if we have the communication between Eastern Asian countries, I think we maybe have some local Asian conference first of all. Just take a strategy that Professor Guang mentioned. We do 2 times of the PCR. We have the meeting together. But if we have the broader international conference with some from people from Europe and the United States, I think today we still have 2 weeks quarantine. So it's not so easy for us to have such an international conference. For the time, I think in the forthcoming several months later, I think maybe we can have some international conference within our Asian countries. I think we can do that. Yeah.
Yeah. So, Professor Zhang, thank you very much. I think
thank you.
We would now like to move forward to the next talk, and it's really a big pleasure for me to introduce Professor Guan again from Singapore, and he will tell us about the experience now, how the situation is in Singapore. But I think we will have time afterwards probably to discuss together Shanghai, Singapore, the experience, and answer also some additional questions here coming from the chat. But please, Professor Guan.
Thank you. Can I be heard?
Yes.
Okay.
Quite well.
Now this is my first slide. I call my talk the Singapore story. My colleagues have been asking me, how come you have got very low mortality rate when you have got a very high infection rate? I'm trying to address this to the audience. Now this slide that I have, the data is about 2 days old. Right now, Singapore has got more than 37,000 confirmed cases, but the death rate is still, there are only 24 deaths. Next slide, please. Next slide. Now, Singapore was prepared for an epidemic after our experience with SARS about 17 years ago. We had a multi-ministerial task force, which was co-chaired by the Ministry of Health and the Ministry of National Development. This was actually formed early in January, even before the first case was seen in Singapore. Now, you can see this slide tells us the total number of cases as a function of time since the 23rd of January. That was the first reported imported case in Singapore. The orange line shows the total number of confirmed cases. The yellow chart shows, the red one shows active cases, which corresponds to the bar chart in the insert. And the green line, the blue line shows those people who have recovered. Can you see the black dots right at the bottom? That is our death, total death in Singapore, 24 so far. In the insert again, you've got these vertical bars, which actually shows the number of cases, daily cases, the total number of daily cases. Now, ever since, because of the presence of the task force and we were prepared, the moment we had our first case, we started intense contact tracing, quarantine, and isolation. We managed to contain all the little local clusters all the way through until March, middle of March. Then there was a certain surge. That was because of our Singapore residents coming back from overseas, bringing the infection with them. Then, towards the end of March, beginning of April, suddenly we saw a lot of local transmission amongst our foreign workers. Now, like most developed countries, we have our quota of migrant workers. We have about 300,000 of them in construction, and they live in dormitories all over Singapore, usually around construction in industrial sites. Can I have my next slide, please? Next slide, please. Now, the picture here will tell you the type of dormitories that they live in. Very crowded, and an ideal place for infection to just fester. Infection increased amongst all these foreign workers. and a mandatory quarantine of 20,000 migrant workers in 2 dormitories with the greatest number of cases was actually done late March. At around that time, the government also decided that to have a limited shutdown, state shutdown, where most people shouldn't go to work, schools stop, and the only things open are essential services as well as food courts. Nobody's allowed to eat in restaurants, only takeaways. Essential services still goes on. Now, in spite of this, the number of cases increased in these dormitories. In other dormitories, in fact, cases were increasing amongst the migrant population, migrant workers. Until one day, when there was a single daily high of about 1,396 cases, which was reported. The next day, the government issued a stop work order for all migrant workers, and all the dormitories were actually shut down. Tracing begins. And that is why, in spite of that, the number of cases still go up. But the number of active cases starts coming down. The lockdown was extended for another month. It was supposed to end in May, but it was extended for another month until June. As you can see, when the lockdown was extended, we don't get much cases, active cases. The active cases are coming down, but the total number of cases are climbing up. This is because of active, aggressive testing. Can I have my next slide, please? Next slide. The lockdown is called, the government calls it the circuit breaker. And now we have actually just finished our lockdown because of the trend of our infection. Next slide. Now, our fatality rate is low compared to rates in other countries with major spread. In the pandemic, 3 major factors usually determine a country's mortality rate. Like in Shanghai, testing, 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 the age of the population, and adequate intensive care facilities. Countries with older populations and countries that exceed their intensive care and ventilator capacities have higher death rates. Countries that test more will detect more mild cases, like we are doing in Singapore, and have a lower case fatality rate. Singapore has an aging population, but the majority of those infected are in the young and healthy migrant workers. Now, we have done to date about 500,000 tests in selected population groups. For example, these migrant workers, as well as homes for the aged, because that is another place where infection are fastest as well. Next slide. Next slide. We also have plenty of hospital beds. We have got a very strong infrastructure. Now, lately, following our experience during the SARS epidemic 17 years ago, a new National Center for Infectious Disease was actually built and was commissioned just before the COVID-19 epidemic. This $900 million building has got 330 beds with big rooms that is designed to manage major outbreaks with its modern state-of-the-art facilities. Rooms were spacious. There is also a self-contained high-level isolation unit for treating high-risk pathogens as well as biothreat agents. These are self-contained. They've got their own unit. They've got their own entrance and everything. They've got their own labs as well. Now, this building itself, I believe there's one in Hong Kong as well. They built just because of the SARS experience as well. And there's prevention of cross-contamination by an up-to-date ventilation system, where the exhaust air, the air that goes from the clean area to the dirty area, is actually filtered and irradiated with UV light before they are sent out of the building. Now, in the early days of the pandemic, most cases were admitted to the National Center for Infectious Diseases, and some goes to the other hospitals where there are beds, isolated wards, as well as ICU beds. The fatality rates were high, and these were amongst the elderly and those with comorbidities like hypertension, obesity. Next slide, please. Next slide. Can I have my next slide? With increasing number of patients being admitted, those who were clinically well enough to be discharged but still have positive nasal swabs were decanted to other isolation facilities in private hospitals and also in resort centers, which were actually modified for them. More isolation facilities become operational later. These were converted from exhibition centers, from unused buildings, as well as ships, cruise ships. This is not the Diamond Princess. This ship is just berthed in Singapore, and it was doing nothing. So they were used to house people who are not well, who do not need hospitalization. So we free lots of hospital beds for the sick patients. Can I have my last slide, please? Now, our lockdown is beginning to ease, and the government is being very slow about it. We are easing very, very slowly. Schools have just started to open. Not all businesses are open yet. Restaurants are not open. Cinemas cannot open. People still have to just go for takeaways. You can see from this figure, which tells us the state of affairs over the last 2 weeks. The death rate has remained the same. Recoveries have increased. Patients staying in community facilities have decreased. Hospitalization has also decreased. So we have sort of controlled the infection, although we have got lots of infections. Most of them are asymptomatic ones. And most of them are there because we have been testing and testing. Thank you very much for listening to my story.
Professor Guan, thank you very much. They're very impressive data. I think we still have some minutes left for discussion, and I think we really should take this time to answer most of the questions. So I would like to remind you to have probably quite short answers to the questions that are coming. And one question here is really the different death rate or fatality rate we have seen worldwide. And probably, as you mentioned, in Singapore, you have one of the lowest rates, but you also mentioned that you have probably the highest test rate. And so what do you think, and also Professor Zhang, is really the real fatality rate of the COVID-19 in a range of 0.6%, because you have a more broader picture of really the overall number of being infected, whereas in most countries, only those who's more severe were tested. So could you please give an answer to this question? So Professor Guan, what do you think? Or Professor
I think
Zhang,
you're right.
Yeah.
I think there are lots of asymptomatic infections. And the mortality rate is actually probably would be lower if the asymptomatic infections were included.
Yeah. And the second question is, what about the attack rate, the transmission rate among close family members or co-workers of either symptomatic or asymptomatic infected individuals? So how many people get infected? Is the reproduction rate really 3 among these family members, or what's your experience here?
From Singapore experience, when one family member gets infected, most of the other family members, 3 out of 5 of the other family members also get infected.
So
the attack rate is actually high within families.
Yeah, yeah.
I wonder what
I would like. Yeah, sorry, please.
I wonder what Professor Zhang's experience is in Shanghai.
Yes, yes. Yeah, actually, in Shanghai, it's different from that in Wuhan. The data from Wuhan is more accurate. So in Wuhan, I think the transmission rate is almost 70%. So in all the patients, you got the infection, and 70% of the cases from the family. So lastly, we decided to set up the Fangchang Shelter Hospital to have the patients just stay at the Fangchang Shelter Hospital for quarantine, but not stay at home. In Shanghai, the family the transmission is much lower because we take the quarantine very early. We quarantine every close contact with suspected cases. So I think today the tracing and the quarantine still is very important. We do not encourage the quarantine at home. Yeah.
I agree.
Yeah. Okay. I think I would not like to say data, but some rumors coming around from people treating COVID that in more recent days, it seems that the, let's say, severity of the disease is not the same as we have seen before. Could you share this view, or is it more that we have better ways to treat and to cope with this infection? Probably difficult to answer, but could you give your opinion?
Yes. Actually, today I think it's a little. I think not so complicated like we first have the patients. But today I think it's clear that severity of this disease is more severe than the flu. So it's very obviously. So the mortality and also is much higher than that in flu. But if we detect every patient we found, of course, we can decrease the mortality of the disease. And I think it should be less severe than the SARS. But of course, it was much more severe than the flu. This is why we should still cannot have the herd immunity in our country. I think this is one side. Another side is still today in some countries like with the high epidemics, I really encourage that to just protect the vulnerable people. So it's very obviously that the disease only attacks the elderly people. So if we protect the vulnerable, still we can go back to normal life earlier. So yeah.
Yeah. So I think we will come to the last question here. And this is really management and treatment of the patient. So what is the strategy in Singapore for, let's say, people with risk factors for more severe disease? If they are infected, what are you doing in the beginning? Is there quite early treatment even before they get severe disease, or what is the medical approach to these patients?
Well, the impression is that not everybody with all these comorbid factors, comorbid conditions actually get severe disease. But when we see this, we do admit these people rather than let them. Most of them, shall we say, most of them are not asymptomatic. But not all of them have got severe disease.
And are you using any drugs?
No, we actually, the people who are under treatment are all involved in trials.
Yeah. And is there anything you can give an advice with respect to the virus affecting the vessels and leading to endothelial damage and thromboembolism and all these things?
Still lots of discussion at the moment, actually. There are lots of webinars going on in Singapore with respect to this increased risk of coagulation and whether to give them anticoagulants or not. but generally we would just treat them, manage them, monitor them, and give them treatment only when they have evidence of all this increased coagulation. We don't treat everybody.
Okay, so
most of our patients are actually not treated.
Okay, thanks, Professor Guan. And in the interest of time, it's time over. So I would like to sum up. And first of all, I really would like to thank the speakers, Professor Zhang, Professor Guan. I would like to thank my co-chair, Professor Guan, for moderating this very nice and important webinar on COVID and the situation in China, Shanghai, and Singapore. Thanks so much for APASL for this great invention and their great interest and helping people around the world with providing the latest information around COVID and liver disease. My special, wishes also coming from APASL. I now have to say that I stopped my co-editorship for the Journal of Hepatology, but being now the Vice Secretary of APASL, so also best wishes from APASL. And I don't know whether anyone from APASL would like to say final words, but otherwise have a good day, stay safe, stay healthy, and thanks a lot for joining this webinar.
Hello, I'm from Professor Kim Owen from Yangon. I'm from APASL panelist. The one that's intriguing me is that the virulence of the strain differ in different countries. For example, in my country, medical facilities are very low, and yet the number of patients requiring intubation or ICU care is very low, and death rate is only now, up to now, only 6 deaths. So I wonder whether the virulence in Asia, Southeast Asia, and Europe, like a very high death rate in Italy, Spain, is it possible, or have anybody considered about the difference of the virulence in different countries?
So we are again in the discussion, but I think we should answer this final question. So Professor Zhang, Professor Guan, do you have an answer?
I will let Professor Zhang answer that if he's still around.
Yeah, yes. Actually, I also actually I noticed that the mortality is firstly I think is about what kind of the patients is the majority in your countries. If the countries not so many elder people, of course, I think the mortality it will be very low. However, if even we have some elderly people, if with the medical resource, we have enough medical resource and lots of ICU beds, and just like Shanghai, we have a lot of the ventilate, and we also will have an ECMO for the severe people. We should decrease the mortality. But if in Wuhan, we know that even in the young people, sometimes if there's a medical capacity overwhelming, still the mortality it will be increasing. So I think the most important factor for the mortality, it should be, I think, the age. The aging people is most the high risk people at high risk. So the secondly, and the medical capacity overwhelming is another very important reason that we should take to prevent the overwhelming of the medical capacity. So these two kinds, if we were doing well, I think we can decrease the mortality for this disease. So just like in some European countries, just like Italy, I think the elderly people is very important. So they stay at a high risk. So mortality is also very high because there was the medical capacity. I think this is what I think about mortality difference. between different countries. Yeah.
Okay, thank you very much. And I think it's also a question and a matter of testing. And I think if we will have a more broader antibody testing among the different countries, we will see that the mortality rate is probably not so different as it looks now. So once again, we had an additional very interesting discussion. So I would like to close the session. Thanks to all of you. Thanks to APASL, and have a good time and stay healthy. Bye-bye.